So today I'm going to be doing an IV push medication on Millie Larson of furosemide. So I'm at the Pyxis already in the med room, so I'm going to go into it, Millie's chart or Millie's profile, and I am going to find the medication that we need, which is furosemide, and I am going to pick that, and that is a tablet, so that's not what I'm looking for. Right here is the one that I'm looking for, and I'm picking that, and I'm gonna get one, and then I need a blunt tip cannula, one of those, and then a 5 milliliter syringe, and then I think that's it. I also need the saline solution, but I don't think that's entered in the Pyxis. So I'm just gonna call it there and press this to retrieve the items. So that is opening all of it. So this would be my vial of furosemide, and as I'm getting this out, I'm gonna double check that this says furosemide 10 milligrams raw, and it's for IV, and it is 10 milliliters, so that is the right one. And then I'm going to grab, here I'm going to grab my syringe and my saline, and also the blunt tip needle. Okay, and then I'm going to come over here to prepare my medication. So as I'm preparing it, I'm going to do my second med check. So right here as I'm doing it, I'm looking, and it is furosemide 10 milligrams, furosemide 10 milligrams for Millie Larson, and it is IV, so this is correct for that. So right now I'm going to clean the top of that in a circular motion, throw that away, and then I am going to attach my syringe to my blunt tip needle, and then fill up the air, and it's 1 milligram, so I'm going to go to 1 milligram and inject that amount of air into the vial and pull that out. And I'm going to pull out more than I need and then flick out any bubbles that are in there. Cool, that was not so bad. So then we'll go to a milliliter, and that's that. So then we are going to do our one-handed scoop to recap the needle. And then I have the saline, and I'm going to take the med to do my third med check. These are garbage, and I'm going to go to the bedside now. And knock, knock. Knock, knock. And I'm going to say, hi, my name's Madison. I'm going to be your nurse today. Can I get your name and date of birth?
Millie Larson, 9/26/1945.
And now that I'm at the bedside, I'm going to be doing my third check. So right here I'm doing is furosemide, and it's 10 milligrams, which is what I got, and the dose is for 1 milligram, which I have 1 milliliter, which I have right here. So that is that, and I'm going to set this down. And then right now that I'm at the bedside, I'm going to scan her wrist, and then scan the vial of medication, and then I would do that in the chart, and then I will get going. So I have all of my supplies here. I am going to alcohol prep the IV tubing, and as I'm doing this, I'm going to be assessing the IV site. So it looks like there's no redness, and it doesn't feel warm at all. So the first thing that I'm going to be doing is a saline flush. So now that I have sanitized that, I am going to open this. There we go. So I'm going to open this and attach it here, and then I'm going to unclamp the tubing, and then I'm going to flush it with about 5 milliliters of saline. Slowly. And now I'm going to reclamp it before I go to my med, to prevent backflow. And then here I'm going to grab my medication, and I'm going to unscrew the blunt tip needle, and I'm going to screw this in right here. And right now the order is for 1 milliliter, and when you're doing IV push, you put that through 1 milliliter per minute. So I'm gonna do that as I'm watching the clock, and I'm gonna unclamp it to do that. And I'm gonna go now. You feeling okay, Millie?
I'm feeling good.
Okay. This won't hurt, it's just gonna feel a little cold.
Okay.
And as I'm doing this, I'm gonna be reassessing the IV site to see if she's having any adverse effects right away. But it seems that there is nothing wrong with it at the moment. And there we go. So now that the med is in, I'm going to reclamp it again. And I'm going to take that off, and I'm gonna reattach the saline solution. And right now I would flush that at the same exact rate as the medication. So I would do that another milliliter per minute, but I'm just verbalizing that for now. So I'm going to put in about a milliliter, and then at the end of that, you would do a pulsing motion at the end. And then you would reclamp it. And then I will take the cap right here and recap that. I also did not mention at the beginning, but I would perform hand hygiene and also be wearing gloves during this process. And that is something very important I would be doing. But now that I've done it, I would check in with the patient, make sure she's doing all right. And now that I'm done, I'm gonna be reassessing the IV site for any adverse effects. But it looks like it's all right. So now that I have the medication pulled up on the MAR, I'm gonna document that on Millie's chart that she was given the medication.